nutritional requirements during adolescence. That is the first part of this topic. So, as you know, adolescence means from 13th year to 19th. That is why we call it by the teenage, 13 to 19. So that is the period of known by the name, generally approved as the adolescence, but it can vary from person to person. So adolescence, one important feature of the adolescence is that, as in the case of the first stage, that is infancy, here also we are finding a period of rapid growth. Rapid means very fast. So there will be very fast physical development, emotional development, as well as cognitive development. These are the three different aspects which are happening during adolescence. And because of that, during the time of adolescence, children will be requiring high intake of nutrients, or high calorie requirements are there. So here you can see that as far as the energy requirements are concerned, high calorie intake is needed for increased metabolic demands, because the body is growing very fast, sexual organs are developing very fast, and because of this more calorie requirements are there. And coming to the protein, around 0.85 gram per body weight. It is not as high as in the case of an infant. In the case of infant, it is 1.5 gram per body weight. So that will be the requirement in case of protein. Then coming to the calcium, because adolescents, the children will be growing very fast, height will be increasing, body mass will be increasing, and the bones will be growing more faster. And because of that, there will be higher requirement of calcium. The requirement of calcium is 1000 mg, 1300 milligram per day. That is the requirement of calcium. Then as far as the iron is concerned, in the case of girl, menstruation start during this time, and as a result more blood will be lost from the body. To compensate for that, the girls will be requiring 15 milligram of iron per day and 11 milligram in the case of boys. So that is, the girls are a higher iron requirement during the time of adolescence. Then another point is regarding the vitamin D, 15 microgram per day. Vitamin D and calcium absorption are directly related. There is a deficiency of vitamin D, calcium absorption by the body will be affected. Similarly, vitamin A for better skin as well as for good vision, especially for the development of our retinal pigment called rhodopsin, vitamin A is necessary. Then there is another mineral known by the name zinc. The importance of zinc is that deficiency of zinc can lead to immune problem. The function for the better functioning of the immune system, 11 mg of zinc per day for boys and 9 mg of zinc per day for boy will be a milligram of zinc per day is required for the girls. So this will give you an idea of how much energy, how much different types of macronutrients as well as micronutrients are needed by an adolescent boy or an adolescent girl. Now go to the second stage, that is pregnancy. Now pregnancy is also a case of high nutritional need. The pregnancy demands an increase in nutrients to support the growth of fetus or the child, as well as to maintain the body of the mother and prepare for the future production of milk or lactation. So these are the three important functions: development of fetus, maintenance of the mother's body, and for producing the milk. So, and all these high intake of energy or high calorie intake is needed. So as calories is concerned, energy needs increase by 300 to 500 kilocalorie per day. Normally we have to eat around 2000 calories per day. Along with that, we have to take additional 500 kilocalories in every day from second to third trimester. That is, first 3 months is okay, but during the second, that is 4th month to 6th month, and from 7th month to 9th month, high intake of calorie are needed. Then coming to the protein, its requirement is increasing around the protein need to increase to 71 gram per day. That much amount. That is most of the time 1 glass of milk and 1 egg and other things can supplement this. Then iron requirement is also increasing, 27 milligram of iron. That is, as a result, most of the women, especially pregnant ladies, should take a iron supplement. You may be, if you have any pregnant sister or other people at home, you may have noticed that they are regularly taking lot of tablets. Most of these tablets are multivitamin tablets, especially folic acid tablets. Then folate, they are critical for the development of spinal cord. So and also neural tube. So 600 microgram of folic acid is needed. If deficiency of folic acid can lead to can affect the development of spinal cord as well as brain, etc. Then calcium is also needed in high level. 1000 milligram of calcium is there. Then another important substance is the fatty acid, especially omega-3 fatty acid, and that will be supporting the development of brain as well as the development of retina. So this is an approximate idea regarding what are the special requirements needed by a pregnant woman during the time of pregnancy. Now, third situation is lactation. As far as the lactation is concerned, the main event during the lactation is the production of milk. Milk itself is an energy-rich milk produced by nature. So it is full of energy, full of calorie. So the energy needs increase by approximately 500 kilocalorie. Normally a person will be taking 1500 calorie to 2000 calorie per day. That is an extra 500 kilocalories of food will be needed during the time of lactation. And especially during the first 6 months of lactation. The importance is that the child will be exclusively dependent on mother, exclusively dependent on the milk supplied by mother. So during that time, there will be high intake of nutrients are needed. So coming to protein, 71 gram per day to support the production of milk. Calcium is also increasing. So most of the time this egg and milk will be giving most of this sufficient protein and calcium. Then iron is needed, 9 to 10 milligram of iron is still needed. Vitamin D is necessary because vitamin D is adequate level in breast milk for infants' bone health. So if there is a deficiency of vitamin D in the milk, that will be affecting the development of bone in the case of child. Then water, increased fluid intake because is necessary to maintain milk production. Normally 2 to 3 liters of milk can be produced during the time of first 6 months. So this is an idea, a brief idea of what are the important requirements. Then fourth stage is the old age. Now in the case of old age will be affecting the normal metabolism of the person, digestion of the person, absorption of the person, and this will be also changing the normal nutritional requirements. So calorie, as far as the calorie needs are concerned, energy needs increase due to decrease due to reduced basal metabolic rate. BMI will be decreasing and the physical activity of the person is decreasing. All this will be reducing the necessity of high energy intake. Then coming to protein, important for maintaining muscle mass and immunity. 1 to 1 gram of per kilogram body weight is needed by a person. Then calcium and vitamin D, these are very important, especially old age people are facing a problem of calcium deficiency. A deficiency of calcium can make your bone very weak, very brittle, so that even a minor fall can result in major bone fracture. So older adult needs 1200 milligram of calcium per day and 20 microgram of vitamin D per day. So that even if your person is older, the calcium requirement is still there. Then iron, in the case of requirements of iron decrease, especially in women after the menopause, that will be coming down to 8 milligram per day in both sexes. Then there is also a high need for more fiber. Especially older people will be facing a lot of constipation, digestion related problem, absorption related problem. So high intake of fiber, 21 to 30 gram of fiber is helpful to prevent constipation as well as to maintain the health of the intestine. Then antioxidants are actually substances that prevent our destruction of many of our cells, and they are also playing an important role in increasing your immunity and also protecting from aging related damages. So antioxidants, especially vitamin C and vitamin E, they can increase the immunity of the person. So more vitamin C and vitamin E means that your immunity is gradually increasing. And then another is the intake of water or hydration. Older adults are at higher risk of dehydration and should aim for 2 to 2.5 liters. That is, unless the people are taking sufficient quantity of water, their skin will be getting more wrinkled. That is one problem. So that is why high intake of water is necessary to maintain your body with sufficient water to keep your skin soft, etc. Otherwise, dryness will be affecting your skin. So this is an idea regarding what are the different special needs with regard to nutrition at the time of old age. ഇനി നമുക്ക് അടുത്ത സെക്ഷനിലോട്ട് പോവാം. അടുത്ത സെക്ഷൻ ഇതിൻ്റെ തന്നെ